Welcome to another episode of the Bleeding Edge of Digital Health. Really excited about today's guest. We've got Cameron Andrews, founder and CEO of Sirona Medical. Cameron, how you doing today?
I'm very well, and thank you for having me.
Yeah, no, super excited about this episode. Um, so you guys have a cloud native, fully integrated radiology operating system that is, after watching your launch video, which was about an hour and a half long, and probably, as I was mentioning before we jumped on the call here, probably one of the best pitches and pieces of content I've seen in a long time. For the listeners out there that have not had the opportunity to check that out, I would definitely advise it. It was incredibly well put together piece. So congrats on that. But
Thank you.
really, it sounds like what you guys are doing is less evolution, more revolution in the AI radiology space. So excited to get involved
It
here.
only took 5 years and damn near $100 million. So
Right?
now that it's done, we had to tell the story as best and fully as we could. So thank you for your kind words, and very excited to dive into what we're doing, but also why we're doing it.
Yeah, no, absolutely, and good segue into the first question here. So, if you can, let's just let everybody know kind of what was the inspiration for creating the company? This was, one of the things that I noted from that video was that almost every single one of the physicians that was interviewed said this was a massive undertaking. It was a very daunting undertaking. What was the inspiration?
The inspiration had nothing to do with the product that we've built. The inspiration really came from my granddad, who's a radiologist who helped start a private practice group back in 1981 by putting one of the first CT scanners in private practice hands in an office building in downtown Minneapolis. And there was a moment in time, starting in about 1981, where radiology was really the first specialty to pull itself out of the hospital. And there was this generation of physicians that my granddad was fortunate enough to be a part of that sort of was able to shake off a lot of the bureaucratic yoke of practicing medicine within the very singular construction of hospital-based care that had been the way medicine had been practiced really historically since time immemorial, and say we can practice medicine better, faster, and cheaper if we just focus on, in this case, doing radiology and radiology alone. And that resulted in not just about 20, 30 years of innovation in radiology, but it really began the process, broadly speaking, of certain parts of care being pulled out of the hospital. And that was, in many ways, radiology has been on the cutting edge of the digitization revolution in medicine. It helped kick off some of the dehospitalization, which has dominated the the sort of healthcare landscape and evolution of the healthcare landscape over the last 2 decades. Radiology, in the words of a chief medical officer of one of the largest insurance companies in the world, who I will not call out because the quote is hilarious, radiology is the most valuable specialty in medicine, and we will never pay them for it, is what he once said. And so the inspiration really for Sirona came from growing up around radiology, growing up around radiologists, growing up around a generation of physicians who were able to not just practice medicine to the best of their ability, but were inspired to do so because they were able to innovate outside the bounds of a hospital-based bureaucracy. And what I saw when I started building software and studied computer science and biology undergrad, that was precisely the moment when AI started to become a very important and powerful technology with the AlexNet moment back in the mid 2010s, and was building AI algorithms for medical image detection and segmentation tasks. And what was clear at that moment was that two things were equally true. Like the software operating system that powers not just radiology, but all of healthcare was meaningfully limiting physicians in their ability to not just practice, but in their ability to be innovative about how they practice. And secondarily, that there was this really powerful new technology that seemed obviously poised to make physicians and patients' lives better. And so the inspiration for the business was understanding just how much better physicians can make medicine when they aren't encumbered by the kinds of either process-based bureaucracy or now the technology-based, the software-enabled bureaucracy that prevents physicians from being able to practice medicine exactly how they want and when they want and in the way that they know is best for patient care. And so the inspiration was that, software has made the whole rest of the world better and seems to have done a pretty good job of keeping doctors from being able to not just enjoy the nature of their work, but innovate as much as I was lucky enough to have a window into watching radiologists and physicians do some decades before.
Yeah, to your point, radiologists really have been kind of on the tip of the spear in terms of innovation in healthcare, from many different respects for the last 15, 20 years. And it's interesting that the technologies that continued to come out were, it was kind of like two steps forward, one step backwards in terms of it would enable some things, but then, you know, create limitations in other areas. So what I'd love for you to kind of lead into next is just, what was the problem you were trying to solve? And I know it's a
Yeah.
complex one. It's probably matrixed, but can you describe exactly what you were trying to fix in the system?
Yeah. Very simply put, AI cannot be valuable in radiology beyond a very narrow sliver of value without the complete re-engineering of the underlying software stack. We've had a $5 billion venture capital funded real-time demonstration of how valuable AI cannot be in medical imaging given the underlying IT stack over the last 7 years. And so given the fact,
And what's that?
oh
What causes that? Is it
yeah,
because of the servers that are needed and the patching together of the different software?
people can make this super complicated. It's super simple. AI is at its essence a technology that can take in images and text and other multimodal forms of data, and then can produce either images or text or other data. Radiology is a business that takes in images. It takes in clinical data in the form of text on the patients, takes in prior reports on those individual patients and radiology exams they've gotten previous, and out and takes in the speech that a radiologist dictates into the record, and out the other end comes a report. If you want to have AI analyze images and produce reports, you kind of got to have those data in the same place, and you got to have the software in the same place. And today, the fragmentation of the underlying software that radiologists use, this engine where they produce the report and where the images live, are literally in separate databases. But what's worse, radiologists will read on not just one entire IT stack, but like multiple in the course of the same day. And so you have not fragmentation just at the data layer and not just at the software layer, but at the entire IT stack layer. And so it is the worst swivel chair and fragmentation problem in all of healthcare, which is saying something.
How is like in the situation you just described, how does that interlace with EMRs and EHRs?
Yeah. It is, no one would accuse the EMR market of being overly fragmented. I think people would
Right.
broadly say that things are quite consolidated, but more than consolidated, the reason why the Epics and the Cerners of the world are so dominant is because there is such a nonlinear value in having all of the different modules that are necessary for a hospital to operate effectively within a single vendor's purview. That what we would now call, outside of that, like the idea of a compound startup, as popularized now by Rippling, but was
Right.
really just, modularity theory inspired by Clayton Christensen from, Innovator's Dilemma fame and one of the great competitive strategists of the technology of the information age. Very simply, what those describe is this, which is when the value of a workflow is defined more by the intersection of its component parts rather than the value of the parts itself. In radiology's case, the value of radiology isn't in images and it's not in reports. It's in turning images into reports.
Right.
Then overwhelmingly, those markets tend towards unification. Now, in radiology's case, that didn't happen because these were all medical device pieces of software. And so the PACS was medical device software. You can only ship it once a year. And the people who built reporting and the monopoly that became Nuance's, radiology reporting platform and PowerScribe 360, that was one of the first major enterprise speech-to-text applications anywhere. So
Yeah.
these were all like technological miracles and really on the cutting edge of what, in the case of PACS and viewing, what you could do in rendering three-dimensional data with like megabits of RAM back in the early 2000s. And then on the speech-to-text side, with being able to drive an entire workflow with speech-to-text, these were really revolutionary things when they were built about 15 to 20 years ago, respectively. And so the reason why the biggest problem in radiology is this. It is a medical device, the software is. So the EMR and the other businesses of this kind that very much do not build medical device software have stayed away from it. But as a result of that, radiology then lives on its own island. And the entire value, I mean, this is like when you think about it in this sense, Radiology in the US is a $140 billion industry.
Right.
The American tax-paying public spend $140 billion a year to produce about 600 million imaging exams. Those influence 80% of all hospital and health system visits. And the insane thing is the job of a radiologist is to compress all of that data, 90% of all healthcare data by volume, and to compress it into a two-dimensional text document that if it's too long, the referring physician won't read, and they can't even bold or italicize words because of the HL7 standard. And so what radiology is tasked with is really a data compression function of taking 90% of all healthcare data by volume, funneling it through 30,000 physicians, and producing tiny text documents on the other end that are probably the most important instrument to route downstream disease care.
Yeah.
And that is a tall order on its own. But when you consider that the software radiologists use to do that is so old that the symptoms of how old it are things like patients getting CDs instead of having digital distribution of information. The problem isn't that patients get CDs from their imaging exams. The scarier thing is your cancer is being diagnosed on software that is exactly that old. And so when you put those two things together, what you get is this. The EMR has stayed away from the radiology IT stack for really important structural reasons. It's a separate problem. It's the only multi-billion-dollar software budget outside of the EMR in modern healthcare.
Yep.
But principally, the fact that they've stayed away is one of the big problems in radiology's ability to provide value. They pass back to the EMR such a one-dimensional form of data that radiology is really limited in the kind of value that it can provide to downstream care. We think that changes, but it requires a revolution in the software they use, which is partially the reason we started this business.
And that was the opportunity for you, right? At that intersection where you could come in and completely not completely redesign, but recreate the platform that they use and make it holistic.
Absolutely. But what I would say very simply is this. When my granddad went through medical school, the amount of information that to be a physician practicing at the cutting edge of a medical license, the amount of information you had to hold in your mind at one time is about an order of magnitude less than what is required today. Now, what that has led to across all of medicine is increased specialization and subspecialization, and that has had a massive impact in radiology on the quality of care as it has in all parts of medicine. But what we're experiencing then, if you take away the flesh and blood of being a person, to treat physicians not as just, people in the world, but think about it as like a data problem. There's more data that has to fit in a physician's brain to do their job than most human brains can hold actively and retain the ability to function. That means that that means that broadly speaking, in order for medicine to continue to become more valuable to patients as a product, we have to find ways to produce more data, and we have to find ways to process that information in a way that one human brain alone cannot do. This is where software is disproportionately valuable, is not doing things better than people, is storing information that is greater than what the human brain can hold in itself at one time and process at one time. And so nowhere is that problem more acute than in radiology because of how big the data are. And so if it's 90% of all healthcare data by volume, and now radiologists and physicians aren't just looking at images when they try to characterize cancer, they're looking at genomic information and other omics data over time, and pathology is going to become closer to radiology and analyzed concomitantly as pathology digitizes. Over what time frame, it's unclear, but as it does, it will do. When you put all those things together, what you have is this: a data problem that is already an order of magnitude greater than what one human brain can hold in their mind at one time and retain the ability to function. That's probably going to get 2 to 3 orders of magnitude larger over the next 10 years.
Yeah,
and so
quickly.
Where AI has the opportunity to fundamentally improve care, and why radiology and medical imaging is at the absolute, is the number one most valuable application area for AI in healthcare on the clinical side, is because it can do 2 things. It can process data on doctors' behalf so that they don't have to sift through all the hay to find the needles. That is one, and the most immediate and valuable function we provide. We can help make doctors faster because they don't have to sift through the record to find the individual pieces of data they want. And number 2, analyze data in ways that find patterns that the human eye can't see.
Right.
And the literature has shown for years that that will improve the quality of care, and by function of radiology being diagnostic, the cost profile of care downstream dramatically. So those two things, transforming the efficiency of care and transforming the product that radiology is able to provide downstream. This
Yeah,
is what AI
capacity and capability.
And if they have no time, we need to first get them the time so that then we can fill that time with additional value they can provide to downstream healthcare. And to achieve not just one, but both of those things, radiology needs a new technology stack to power it.
So let's jump into it. What did you guys build?
Everything all at once as one, jokes is we built all the software that radiologists need to practice in one unified and cloud native platform. So for the radiology nerds, that means the PACS system. So that's the image storage function. The viewer, where they manipulate images and interpret those images broadly. The reporting platform, which is a speech to text driven place where you create the clinical record. And then the work list, which is like a to-do list for not just a radiologist, but for the whole practice. We put all of that into one unified cloud native platform, which means you don't have to manage servers, you don't have to manage integrations and all the different places the data comes from and has to go to. We manage all that for our customers, all that stuff. In our estimation, what we had to do was to build the Epic for radiology in order to be able to then build the assistive AI that will make them faster and allow third-party AI companies to build the kind of diagnostic AI that is the future product radiology will provide. And so what that means is one doctor can buy Sirona and practice medicine and practice radiology. And they don't need any other software or any other support in order to be able to practice radiology.
Or hardware.
Or hardware, exactly.
Because the legacy systems were all built on servers and had to be networked. And so you're taking all of that off the table. When I was going through the launch video, this isn't a direct correlation, but what I thought in my mind was this is the Salesforce.com of radiology.
That's directionally correct. That's exactly right. I mean, I think if you think about Salesforce as the operating system for your sales team, there's a bunch of data that has to come into a sales process. There's a bunch of stuff that has to happen in order to sell stuff. And then you got to make sure that people are paying. That is the entire commercial function of any company that runs on Salesforce. They built the operating system for that. I think that's a perfect analogy. And interestingly, exactly the way Salesforce displaced Siebel back in the day is in many ways exactly the way that we are executing our go-to-market strategy as a business, which is that we are able to overlay on top of all of these practices, legacy system of record platforms, transition all the physicians over to reading on one platform before they unplug all these boxes. And then they can unplug their legacy systems as they choose, when they choose. That process of overlay and then displace makes it possible and convenient relative to what would otherwise be the state of the art with legacy platforms today for these practices to make what is otherwise a difficult transition off of their legacy infrastructure and to a new paradigm.
What's the where is it at commercially? Is it are you guys out? I know you've got some customers, but where are you guys at it with that?
Yeah. So we are partnered today with about 4% of the US radiology market by number of physicians. That does not mean that all 4% are doing all their exams all day, every day on the platform. It means that we were fortunate enough to partner with 7 of the top 50 private practice radiology groups in terms of scale, some 3-4 years ago, and build alongside them for the better part of the last 3 years. This was a 5-year, very expensive R&D process to build not one, not two, but multiple billion-dollar markets worth of legacy software into a modern architecture so that then we could deliver all the AI value that comes after that. That R&D process, we were fortunate to do along some of the most innovative and largest physician groups out there that themselves care for over 15 million patients a year. And,
Wow.
and so we are integrated and live with all of those groups today. That does not mean we're fully rolled out. It doesn't mean that they're doing anything other in certain cases than doing live clinical testing to provide feedback to us as we do. But we do have about 1% of the US radiology market that's live between our 2 subscription packages. Some of those are using the whole of Sirona. That's what we call our unified subscription package. That's the whole kit and caboodle, so to speak. And then, or using what we call our simplified subscription package, which is using the platform as either a business continuity solution or a replacement for their reporting platform. So today we are partnered with 16 or 17 practices as of just this last week. that should expand to 20 within the next 30 days. And those practices themselves care for tens of millions of patients a year.
And this was built in conjunction. It was built on AWS servers, right? Cloud servers,
That's right.
but it was built in conjunction with Amazon. Is that correct?
Well, I think anybody who's building on a cloud platform is building in conjunction with them. But what I would say is we built our platform to be broadly cloud agnostic. That said, there are things the AWS platform gives us that are particularly strategically advantaged. As an example, in 2022, AWS released what they call Glacier storage with instant retrieval. The reason anyone should care about that in medicine is that it allows you to store massive amounts of data for almost no money and access them instantly whenever you need to access them, and you pay at the time you have to access it. In imaging, one of the 90% of the cost of data storage comes from the fact that once you take an imaging exam, like maybe you'll access it again within the first 6 months. 90+% of all access happens within the first 6 months of an exam occurring. And then you are required by federal mandate to store that data for upwards of 7 years.
Right.
But when you need to retrieve the data, it can't be 2 hours before you retrieve it. And so you need that instant retrieval. And the result of that is that if you're doing this in an on-prem paradigm, you have to pay for hot storage for all of your 7 to 10 years worth of historical archive. And that's wildly expensive.
Yeah.
Historically speaking. What this new storage tier allows for is for the 10-year data storage cost for Sirona to be about 6 cents in total for an average exam to be stored for 10 years.
Wow.
Now, the value of that is not that we charge nothing for our service, because then we wouldn't be a business, but it means we can take all of the money that otherwise would have gone out of a radiology practice's budget towards storage, which creates no value, and do the most winningest Silicon Valley strategic thing in the history of Silicon Valley, which is take storage dollars and put them towards compute. And we can take that additional budget and make AI available as part of our core platform. We can take storage dollars and build intelligence and provide a service to our customers that is either cost parity or cost savings, but where the money isn't going towards storage, it's going towards the kinds of intelligence and efficiency driving AI that practices want and need in order to be able to meet the demands of the next decade.
Yeah, it's incredible. What cost-wise, in the video, it referenced, like a 10x reduction in cost. Talk us through that real quick. Like, what's is it obviously there's a reduction in hardware, storage costs? It sounds like there's a big reduction there. Where else are you saving dollars?
So in the 10x that you were referencing is relative to the cost of data storage. And so that was the illustration that I just gave before. What I'll say about the nature of our strategy is this. Radiologists today don't just pay for a PACS or for a reporter or all these things, or just the servers and the IT folks who have to spend their time keeping these things from breaking, which they do all the time. They also have to pay for upgrades for PACS and reporting. And every time they do that, it breaks. So they have to pay for all the services around that. There's a bunch of like asterisks around all of this that come as a function of really one thing. Like radiology IT today is like trying to build a PC with parts from Radio Shack.
Right.
You need expertise to do it. Nobody really knows how you did it unless that's the thing that you love doing as a hobby. And you also don't get a really great experience on the other end. What we've really tried to create and what we believe, reason why we call our system a Radiology Operating System or RadOS, is that what we've sort of intended to create was in some ways like the iPhone moment for radiology. It's all of the stuff that they need in one package that itself is priced at a premium price point. We may end up saving practices money because they're spending money on so many different categories.
Sure, in aggregate.
But in aggregate. But the result of that is that we're able to bundle together not just the software they need and the servers they need, but also services that they need, like integrating into new business as part of the underlying platform and so on. Yeah. And so you put those together and what you get is this. We spend our money. We spend our customers' money on two things. Building new features that they get for free as part of their core subscription package. And number two, on the best customer service we can possibly provide as part of the core system. And lastly, on as much AI as we can build and ship through the platform to help make them more efficient. Because there is no value we can create on the cost side that will be more valuable to these practices than helping their physicians be step function wise more efficient. And so that's really our purpose as a business. Take the money that today doctors are already paying for stuff that isn't value add for the practice, but is necessary, like data storage, like servers, and so on, and take that budget and build an operating system that makes the practice, the doctors, and the business as a whole more efficient, and therefore the company more effective in providing radiology services.
Yeah, well, it makes perfectly good sense, and also the other thing that I thought was neat is you guys enable third party vendors to come in and sit on top of the platform and to be able to build on top of that. So if there's somebody that's got a really good idea, you can incorporate that into your offering, and it works seamlessly, within your operating system, right?
That's exactly right. And the perfect example here is this. There was no app store market that
Right.
really mattered until, for PCs, until Windows, and until in the mobile phone market, until the iPhone or iOS and Android were created. It is the sort of logical progression of new compute paradigms that you build the operating system and then the applications are built on top. What we've seen in radiology is that $5 billion of VC went into trying to build AI apps, and the only AI companies that succeeded in creating value had one thing in common, which is that they avoided the radiology workflow entirely. And so unless you believe the $6 billionth is going to be the thing that solves that problem, then that really fundamentally says is it doesn't matter what market you're talking about, companies built in the Asian market, in the European market, in the US market, underneath all of them is the same software that is broken and fragmented and therefore cannot support complex, powerful AI applications,
Right.
and the workflows around them. And so the punchline here is this: AI is not a product. AI is the engine of a given workflow. We have built the radiologist workflow and the platform through which third parties can build workflows within the radiology problem space in order to solve really deep clinical problems that start to look a lot more like software as a medical device,
Yeah.
than even just sort of AI algorithms on their own, if that makes sense.
Yeah. No, it's incredible, man. I'm super excited to watch you guys continue on with the mission. It's the, the doctors in the video were right. It was a massive undertaking. It took a lot of money and a lot of time, but it sounds like you guys really did it right. And this is radiology is a big problem that we've got, but there's a lot of other big problems that are going to need to be addressed in similar ways. This one was unique because of and we had this conversation when we first talked. This one was unique because of the inability for the radiology systems to talk with the EHRs, EMRs. I didn't know that before. There's a lot of other. It'll be interesting to see if some additional founders come out and follow this model of kind of a redesigning the system from the ground up.
I really hope they do, and here's why. When I spent about 3 years moonlighting at a venture firm, which was founded by and run by some of the smartest human beings I've ever met. And they invested in everything from pinhole satellites in space to like LiDAR technology, like infrastructure to power self-driving
Yeah.
cars, all the way through to hypersonic missiles. And the only thing they said, the number one rule of healthcare investing was that, was defined by rules number 1, 2, and 3 were never invest in anything that even touches system of record infrastructure in healthcare,
Yep.
let alone tries to displace it.
That's right.
And so we at Sirona, we started this business because we believe that that AI is a sufficiently powerful enough technology so as to demand the complete re-architecture of healthcare IT as we know it. That means both the imaging IT stack for our part as well as the EMR. There's a very real possibility, and I hope that the businesses like Epic and Cerner and others like this are doing that re-architecture themselves at this moment, and I suspect they may be. But what is going to be necessary for patient care to be made better, not just healthcare to be made more profitable for provider organizations or payers or so on, that AI is going to make its way into the world one way or another a lot faster.
Right.
To actually fundamentally change and make better care for patients is going to require two things. AI that is a medical device, because you cannot influence patient care and have it not be a medical device.
That's right.
And number two, in order to facilitate that, a re-engineering and a complete re-architecture of both the system of record and the system of interaction layers of the technology stack in healthcare to enable that. That's happening for our part in radiology. You see it happening in dental with businesses like Overjet. You're
Yep.
starting to see it happening in fertility care with businesses like A-Life Health. There are founders, and there's a small community of people who have been executing against the strategy for some time. But there are so many corners of the healthcare problem that demand the following solution, which we believe is the greatest opportunity for software, enterprise software, on a 10-year basis, to rebuild the system of record for a given specialty in medicine to create vertically integrated, specialty-specific workflows that make physicians both more efficient and effective in a way that drops to the bottom line for provider organizations. You put that together, and we believe that there should be a Sirona for pretty much every specialty,
Yeah.
especially those that operate in an ambulatory capacity outside of primary hospital operations. And we believe and hope that in the process of showing how much more valuable radiology can be to every other specialty that is practiced through the EMR, that the businesses that control those budgets and control those tech stacks today are inspired to do that rebuilding, which we hope and expect that they will do. And it's going to take a long time and a lot of money for them to do it as well. But there ought to be that re-architecture, those re-architecture conversations happening at the startup level, in rooms of people who could start those companies, as well as in the C-level meetings at the largest EMR and other workflow businesses in healthcare today.
Yeah.
Because the technology is here that demands they do that re-architecting and do it now.
Yeah, yeah, I think you're right. I think we will see it, and there will be fast followers, and there's enough problems in healthcare for a lot of people to jump in and fix those problems. So, and hopefully, some to your point, so, it's not just on the early stage companies. Usually, that's where the innovation happens. But some of these big companies, some of that reliance falls on their shoulders as well. We'll see if they follow through with that. But
well, and the funny thing is this, ironically, one of the reason why investing historically in system of record infrastructure in healthcare was a terrible idea, past the initial V1 companies, was because of how extremely difficult as to make it functionally impossible it is to displace not legacy software, but the brand value of those businesses. And the thing that's quite interesting is what that's left healthcare in the position of being, perhaps the unfortunate singular position of being, is maybe the only industry, but definitely the biggest industry in the American economy, where software is so arcane so as to prevent AI from being layered effectively on top.
right.
So nobody is going to invest in the AI-powered Microsoft Word, because that's just Microsoft Word. They're going to layer that on top, and it's going to make that product better, and it's going to make it perhaps even more entrenched. On the other hand, what we've seen in radiology, we believe, is going to be the experience that all of medicine sees. Radiology saw it first because computer vision evolved before natural language processing did, and imaging is, radiology is the only principally digital imaging-based specialty today. Then what you get is really the following. Radiology saw over the last 7 years what all of healthcare will see over the next 7, which is AI can do some stuff, but it cannot do all the stuff that it is capable of doing, and the delta between the value AI can create on top of today's system of record infrastructure in healthcare and what it can create in theory is so great that it demands the re-architecture of the operating systems that power clinical healthcare. And we started this business before it was obvious that that was true in imaging, even if it was obvious to us. And we believe that across the broader Silicon Valley and technology ecosystem, there are folks who are thinking deeply at both the incumbent vendors as well as in the startup community about what magnitude of capital and time is going to be required to solve this problem in full. And the difference between now and 10 years ago is there is enough capital around the venture ecosystem to fund the necessary R&D to re-engineer, in this case, imaging, but all of the different systems of record that power healthcare today.
Yeah, it's going to take some courage, but I believe that we've got the people out there to do it. The Elon Musk types and people like yourself that just jumped in and said, you know what, this needs to be better, and I'm going to make it better. And that's what is so amazing about our space is, I hear from founders all the time. They say, if I'd have known it was going to be this hard, or if, the healthcare side of it,
Yeah.
there's a lot of other ways to go make your millions in a
Yeah.
much faster, easier fashion with a lot less brain damage. But but you do it because you make a difference.
Yeah.
And that's the cool piece. So really appreciate you coming on, man. I didn't get to ask all the questions I wanted because I could talk to you all day about this stuff. It's what you've created is something really special.
Thank
So let's put a placeholder in 12, 18 months and get you back on the show. We could do an update and see where you guys are at.
That would be a lot of fun. I'd love that. Thank you for having me, and very much looking forward to doing it again sometime soon.
Appreciate it. That's it for this episode of The Bleeding Edge of Digital Health. We'll catch you on the next episode.